It's Dr. Rosekelly from Fruitful Oaks Direct Primary Care here in Duncan, Oklahoma. We are a small town clinic, but we have a vision to transform the world and the healthcare system, which is in disarray. I'm reminded of that today, and reminded also of how out of touch our politicians are when it comes to healthcare and how to work healthcare in the U.S. I had a conversation with an eye doctor yesterday, and he was talking about his relationship with Medicaid. Now, I no longer work in a system that takes any insurance, and so sometimes I have to rely on my buddies to have an inside story, an inside scoop into the problems. In Oklahoma, the Sooner Care system, which is Medicaid, has created a new law. It sounds great. It's a Information Sharing Act, which requires anybody who takes care of more than 500 Medicaid patients in a year to participate in an information sharing database so that this information can be passed on to other people in the system. Sounds great so far, right? What's the catch? There's always a catch. The catch here is that in order to participate in the information sharing system, you need to pay $5,000 up front at the beginning of the system. Then you pay a fee. This is the physicians and providers who are taking care of Medicaid patients have to pay a fee every time they see a Medicaid patient. How do we think it's appropriate to have a system where providers, physicians, and dentists, and all these other healthcare providers are providing care to an underprivileged system, and you think it's appropriate to charge those providers a fee to take care of an already low-paying population? Medicaid is almost not worth it anyways. And now you are going to charge people for using and taking care of Medicaid patients. What's going to happen is people are going to say, no thank you. I'm not going to pay to see somebody who you are not going to pay me to see at even a market level rate. It's unbelievable. Today is Money Monday again. And this is a day where I take some time and talk to you about ways that you can save money on your health care. We alert you to websites and to different options to lower your cost. And this is true whether you have insurance or not. Today, I want to bring your attention or to talk about sleep studies. We use a sleep study mainly, but not only, to evaluate for something called sleep apnea. And I often talk to my patients about the dangers and the risk of sleep apnea. When I make a list of things in somebody's life that frighten me about their health, I list number one, obviously, smoking. And this is not, certainly recreational drugs are not good, but specifically smoking in a large population is right at the top of that list. Next, I would put on that list diabetes. Diabetes impacts the brain. It impacts the stomach. It impacts your blood pressure, your heart, your healing properties, your ability to heal, your nerves. It impacts everything. And so that's a really important medical condition to get under control. After that, I put sleep apnea. Why is that? Well, sleep apnea is a condition where when your body is supposed to be resting at night, it actually is working hard to sustain you, to give you oxygen. Sleep apnea is a condition where your body closes down due to maybe small airway, excess weight, lots of reasons. And your body is not getting the amount of oxygen it needs at rest. There are certain physiological things that we expect to happen at night when you go to sleep. We expect your blood pressure to drop, your heart rate to drop. Maybe your oxygen levels dropping a point or two. But in sleep apnea, what happens is your oxygen levels suppress to a level that is dangerous for the body, and the body recognizes that. And so what it does is it increases your heart rate and increases your blood pressure, therefore putting on constant stress to the body. When at a time when your heart should be resting and your veins should be resting, they're working hard. And so this has long-term complications, increasing obesity, increasing high blood pressure, increasing anxiety. It increases your risk of having a heart attack and stroke. So getting evaluated for sleep apnea is important for high-risk individuals. High-risk individuals tend to be male, tend to be overweight, tend to snore loudly, and the telltale sign is something called apnea. Usually our spouses will say, it's like he stops breathing in the middle of the night. He'll be snoring, and then a long pause. That pause is what we call apnea. The body is literally not breathing for a second or 2 seconds until the body recognizes it's not sleeping and then wakes it back up. It'll be a snore, pause, snore. And that will happen overnight. So the way we evaluate this is through a sleep study. The problem is, traditionally, a sleep study is done in a sleep lab. A sleep lab is a place where they put a bunch of electrodes on your head, on your oxygen sensors. It also measures the loudness of your snoring, measures your breaths. And so a sleep lab will do this, but it's very expensive. Even with insurance, sometimes a couple $1,000s. And so if you're paying cash for your medical care, that's a difficult pill to swallow, if you will. What we've found is that in most people where we are fairly confident that they have sleep apnea, that we can do a home sleep study for fractions of the price. Typically about 10% of the cost of a sleep study. Somewhere around $150, $200 you can get a sleep study done through us. What we do is we have a company that we have a relationship with. We send them a fax saying we need a sleep study done on this person. They'll call the patient up directly, charge them directly. $150 is what our price is. Your price might vary from that, but it shouldn't be too much more than that. They mail the sleep study kit to the patient. The patient wears it for 2 nights, sends it back, gives us a report. I feel like our reports have been effective. Our reports have been thorough enough to provide us with the information that we need. If you nailed me down, I would prefer a in-lab sleep study. I would. But not 10 or 20 times more than a home sleep study. The reality is I can't convince my men in my clinic to go to a sleep lab, to take a day off of work, to not sleep well in a foreign environment, just to be told that the sleep study was inadequate because they weren't sleeping at all, because they were in a new environment and it was difficult to sleep. I found the information to be helpful enough to get them a CPAP machine and to save lives. So for $150, if you have a loved one who you think has sleep apnea, reach out to somebody. You really could save their life. I had someone the other day, or a couple weeks ago now, say that it's like they're living a new self, a new life, after getting a CPAP machine. They are rested throughout the day. They're not having headaches. Another thing I'll say is that if a person says, I think I have sleep apnea, I can't sleep at night, that's actually not a sign of sleep apnea. A sign of sleep apnea is that you feel like you sleep really well at night. You wake up after 9 hours and you're tired. And you're like, I don't understand why I'm tired. I slept all night. That's sleep apnea. Typical male, obese, high blood pressure, large neck is another big sign of sleep apnea. A narrow passageway in the mouth. If you have any concern that you have sleep apnea, talk to your doctor. There's a couple surveys, a couple questionnaires that we do to help guide our thinking on sleep apnea and to get you the sleep study that you need. But don't, if you want to, spend $2,000 on a sleep study, but consider, if that's a little steep for you, to consider a $200 or $150 sleep study and get most of the information that we need. That's a wrap for Money Monday. Thank you for listening. You all have a great day.